Hi, good evening. My name is Eric Schiffman. I'm an orthopedic surgeon. Thank you for joining us tonight. Basically, what I want to do is talk a little bit about bone health. Now, unfortunately, I'm having some issues with my computer camera, so I'm using my cell phone, but I'm going to put this down and we'll go to a PowerPoint presentation, and then at the end, I'll entertain any questions. So before we get started, just a little bit about myself. I'm an orthopedic surgeon. I've been in the area now almost 8 years. I've been in practice about 9. And my practice is mainly hip and knee reconstruction and dealing with arthritis, but along with this comes a lot of issues with bone and bone health. So I went to medical school at Albert Einstein in New York. I then did my residency down here at Jackson University, Miami. I did a fellowship at Mass General in Harvard Medical School. And then after that, I did a practice for a couple of years up in Columbus, Ohio, but relocated to South Florida in 2014 because essentially kids were not super happy in the snow. So they went from that to now this. Good change. So there's not much funny about bone health and fractures, but I tried to add a little bit of humor to the presentation. Well, you guys might not find it funny, but at least I find that humorous. So let's get to it. Osteoporosis basically means porous bone. So instead of being nice, thick bone, as you get older, the bone becomes very porous like a sponge and leads to easy fractures. And if you see this slide, a lot of the reasons why when people get older, they say they shrink, is actually their bones in their back. They're getting smaller and smaller. They're getting weaker and weaker, which causes them to collapse down, and basically people get smaller and shrink. Now, osteoporosis is the most common bone disease. Now, we don't often consider it a disease, but it truly is. And it's one of these silent diseases. People don't feel that they have this problem until it's really too late. The biggest risk factors for people with osteoporosis are women over 65, so postmenopausal and light-skinned, as well as if you have any kind of family history of fractures. However, that being said, all races and sexes are susceptible, but mainly the light-skinned older women are the ones that get this the most. Now, the good thing is this is preventable and treatable. So this is a slide of medical risk factors that are really the number 1, 2, 3, 4 causes for developing osteoporosis. The main one being things like lung disease and then certain deficiencies. And there's also medication risk factors. Steroids, very common. Steroids can cause the bones to become thinner, as well as other medications, especially thyroid medications. Again, this is what we call a silent disease, just because this is something you don't feel. You could have osteoporosis and have no symptoms until you actually break a bone. It's estimated that up to 10 million people have osteoporosis, and 1 in 2 women and 1 in 4 men will have a fracture at some point. There's over 2 million fragility fractures a year. So what is a fragility fracture? It's basically a fracture that comes from a fall from standing height. When you're younger and you fall, you don't break a bone unless it's a really bad impact. But when you're older, even a simple fall can cause a hip fracture, a spine fracture, a wrist fracture. And these are what we consider fragility fractures. A woman who fractures her hip, a woman's risk for having a fracture, is actually higher than the risk for developing most of these major serious cancers. If you look at these numbers, in 1990 versus in just 20 years from now, the incidence of hip fracture is estimated to double. And that's just because our population is getting older. And as people get older, higher chances of hip fractures. And again, this is a slide of the elderly population growth, right now in 2020, and even up until 10 years from now, it's going to get significantly greater, the amount of people over 65. Hip fractures account for over 300,000 hospitalizations a year. And so why do we care so much about this? So what? People break their hip. Well, the biggest problem with people breaking their hip is a lot of times this is just kind of the tip of the iceberg. 25% of people who break their hip will die within 1 year of the hip fracture. And the other 25% lose their independence and require long-term care. So this is not only, is a problem with the short-term treatment of hip fractures, but long-term, it really has detrimental effects on people's health and quality of life. So we do take these hip fractures seriously. And if you've had a fragility fracture, you're twice as likely to develop one in the future. So where it comes to the point of once you get diagnosed with either osteoporosis or a fracture, we do recommend treatment. And we've actually had multiple studies showing that people that develop a fracture, most of them did not get any kind of treatment for this after their hip fracture. Over 75% break a hip and they don't get any further treatment, leading them to being twice as likely to getting another fracture. So how do we diagnose it other than a fracture? So once you get a fracture, a fragility fracture, you do by definition have osteoporosis, but there are ways to test for osteoporosis even before a fracture. A DEXA scan, it's a low dose x-ray that's used to measure bone density. And there's a bunch of numbers that come along with the DEXA scan, but the one that we really look at is something called the T-score. If your T-score is -1 or above, you're in the normal range. If you're -1 to -2.5, you have osteopenia, which means thin bones. And if you're lower than -2.5, you have osteoporosis and should have serious conversations about treating this. And again, this is all compared to peak bone mass, which is thought to be in females about 30 years old and males slightly older. So this score is all relative to what the peak bone mass should be. So when should we start treatment? So the modifiable risk factors, those definitely should be modified after the age of 50. Those things are like smoking, drinking, if you're underweight or malnourished or being sedentary. Those things, we can change the risk factors. Now there's certain things that, you can't change or are not modifiable, things like, genetics. So that's where we start talking about doing medical treatment. Medical treatment, there are some medications you can take to prevent treat osteoporosis, I should say. And that's really started if you have a T-score of -2 or greater, if you've had a hip fracture already, or if you have a T-score of less than 1.5 and have another history of some type of wrist fracture or any other fragility fracture. Now, as far as kind of prevention, it is recommended that everyone gets a daily amount of calcium and vitamin D, but I have to give you a caveat to this is for many years we told people to take calcium, vitamin D. There's been newer studies out there that say it may not be as effective as we once thought, although still the current recommendation is to get your daily recommended amounts of calcium and vitamin D. So in women, that's about 1,200 milligrams a day. In men, that's about 1,000 milligrams a day. And you could get that through dairy, you could get through supplementation. As far as vitamin D, women are supposed to get 600 international units a day, men 400 international units a day. There's 2 ways to get that, or actually I should say 3 ways. You could get supplementation with vitamins, sunshine, plain old sunshine, at least 5 to 10 minutes a day will give you the amount of vitamin D you need. And then there's foods like fatty fishes or milks that are fortified with vitamin D. Number 2, this to me is the most important part, being physically active, actually putting weight on your bones. That will help strengthen your bone and actually helps improve balance to prevent falls. So there's weight-bearing exercises, things like walking, jogging, dancing, weightlifting. And then there's actually things to prevent falls, physical therapy, and then simple things like removing clutter from the home. Now, what's interesting is when a person falls, when they're younger, they tend to fall forward. When an older patient falls, they tend to fall directly onto their hips, leading to increased risk of hip fractures. So step 3, based on the CDC guidelines, is to avoid things like smoking and alcohol. Again, modifiable risk factors, so if we could modify them, we should. And then this is a simple step, talking to your doctor. A lot of people, when they go to their doctor, there's a lot of issues they have on their mind. And really the last thing is bone health. And most people don't have a conversation about bone health and their last DEXA scan or the bone density scan, and if they have any risk factors and their family history. So it's something that I encourage everyone to talk to their primary doctor about. And whether or not, you've ever had a bone density test or not, it's something that getting one is a good idea. And then we follow those every 2 to 3 years with new bone density tests. And then getting the bone density test is really the important part. If you look in the back, that little picture, it almost looks like a tanning bed. It's just a glorified x-ray, very quick, simple, painless. Now, assuming that you get diagnosed with osteoporosis, how do we treat this? So there are different medications. There's a class of medication called bisphosphonates, and these are things you may have heard of, like Fosamax, Boniva, Prolia. Basically what these do is they stop the cells that eat bone, called osteoclasts. And they've been shown to reduce fracture risk from anywhere from 25 to 70%. And then there's another class of medications that actually supports the cells that build bone, called osteoblasts. So both will accomplish the same task, but they do it in different ways. So typically how your normal body works is you have two cells that compete against each other, called osteoblasts, which build cells, and osteoclasts, which take cells away. When you have osteoporosis, you tend to get an overabundance of those cells that eat bone, called osteoclasts, and that gives you what we call a negative bone balance, or increasing your risk of fracture. The medications work to either stopping, like I said, those osteoclasts, or building those osteoblasts. But essentially the point is, if you look at this slide, after treatment, that bone on the left, which is an example of what we call a vertebral body, which is in the back, if you look at how thin the edges are compared to after 21 months of treatment, much, much thicker. And thus, if you do have a fall, preventing fracture. And treatment does reduce the fractures. Treatment of osteoporosis does significantly reduce risk factors for having another fracture. So like I said, very, very important. Now they do, you'll go online or see certain things. They do make some protectors. So this is kind of like a girdle or a garment that you could put hip protectors in there. You know, in my 9 years of doing this, I have yet to have a patient that would be willing to wear this. There are some other products on the market, but really, I'm not really a huge fan of things like protectors. And then, you know, just to sum it all up, there are some building blocks to bone health, the calcium, vitamin D, like I said, exercise and fall preventions. Those are my #1 and 2 ways to prevent this. And then what's not included on this, other than, you know, what we spoke about, it's really testing and speaking to your doctor about bone health. There is Surgeon General's warnings and guidelines about this, and the National Osteoporosis Foundation has a lot of information about bone health, so I'd encourage you to go check out their website for tips and tricks about preventing fractures. Well, I definitely appreciate your attention and your time during this, and if there are any questions, I'm happy to answer. If not, you know, definitely speak out to your primary care doctor or your orthopedic surgeon, or go on to the National Osteoporosis Foundation to get more information.